There are different kinds of bursitis in the hip area. And the psoas bursitis is one option. This is a pretty big bursa, about 7 centimeters long, 4 centimeters broad. Perhaps when we have a bursitis over there, we can really palpate the swelling. So the patient is going to have pain in the L2, L3 dermatome, so the groin, anterior leg. Passive flexion is painful, lateral rotation and extension are painful with a softer end feel, but the main positive test is the passive adduction we perform from 90 degrees flexion. This is really the #1 test. This lesion reacts really very well on infiltration. The technical aspect of all injection and infiltration techniques is also described in separate films in this online masterclass. It's quite possible that you have such a swelling in this bursa that you can also have pressure on adjacent neurovascular structures, resulting also in paresthesia. So if the patient describes paresthesia, this is not necessarily unusual. Another bursitis is the gluteal or the trochanteric bursitis. So this is the area of the greater trochanter. Patient is describing lateral pain. Walking is painful. Walking on the stairs is painful. Sitting is not painful, but sitting with the legs crossed over, that could be annoying. Perhaps a sudden twinge. Lying on that side during the night is unpleasant. Some passive movements could be positive. Perhaps the passive and resisted abduction could be painful because of stretch on those structures and compression on those structures, but the word could is important. It's not a fixed clinical image. And we have to realize that there's not just one bursa over there, there's a combination of different bursae. So that's why the clinical image can vary a little bit. A bursitis could also be secondary to an arthritis of the hip joint, so it's quite important to interpret the outcome of your functional examination. And it's also not uncommon to have a bursitis after a total hip replacement, so that's perhaps also interesting to know. This kind of bursitis can also be treated by infiltration, and we have, depending on which bursa we would like to treat, the direction of the infiltration is going to be different. But again, this is illustrated in the films on infiltration techniques. And then finally, there is one more type of bursitis, the ischial bursitis. And that's really a very typical story. The patient says, I'm sitting, I have pain, I stand up, I don't have pain, and they prefer to sit on a soft chair or couch. When they have to sit on a hard surface, it's very unpleasant. What do we find in the examination? Actually, nothing. We just have a local positive palpation. This is of course the same area as a lesion of the origin of the hamstrings we discussed in another lecture, where in that case we would have positive resisted test. With this bursitis, I can't exclude you have a positive resisted test, but I don't expect it too much. But anyhow, if you have doubts, you can do a test deep friction on that localization, and if it's a bursitis, nothing is going to change, and the treatment is also going to be an infiltration. Of course, you could have a combination of the two, because there is a close anatomical relationship between bursa and tendons, so perhaps they need an infiltration and perhaps they also need friction massage. So keep that in mind. So conclusion, when we talk about bursitis in the hip area, there is really no real fixed clinical image. It could be a confusing image, which is normal, and if you want to be sure, then it's a good idea to confirm your diagnosis with a diagnostic infiltration.